Before we start diving into our topic today, I'd like to give you a short introduction to our work at Healthcare Without Harm Europe. So, Healthcare Without Harm Europe, we are a non-profit membership coalition of hospitals, healthcare systems, healthcare professionals, local authorities, meaning regional governments, regions, research academic institutions, and environmental and health organizations as well. And the aim is to bring the voice of healthcare and healthcare professionals to the European policy debate about key environmental issues such as chemicals or climate change and health, as in this case, green building, healing environments, sustainable procurement, pharmaceuticals, as well as sustainable food and waste management. And also to empower the healthcare sector to understand the importance of the environment and healthcare's impact on the environment, pressing healthcare leaders and professionals to advocate for a broader societal policy and economic change. When it comes to the Healthcare Without Harm theory of change model, we have a vision of a healthcare that mobilizes its ethical, economic, political influence to create an environmentally sustainable and equitable, healthy world, with a mission to transform this worldwide so that it reduces environmental footprint and also becoming a community anchor for sustainability in the global movement for environmental health and justice. And when it comes to the overarching goals, number one is climate change, protecting public health from climate change through the transformation of the supply chain. As we know, healthcare has a huge purchasing power, and also to build leadership for environmental health. And our other main policy areas include pharmaceuticals in the environment, antimicrobial resistance, including sustainable and healthy food in hospitals, climate smart healthcare, which has three pillars in our work, namely mitigation, resilience, and leadership, sustainable health procurement, also safer chemicals, alternatives, and as well as waste and resources. So when it comes to our membership structure, currently we work with 88 members in 25 countries in the WHO European region, including 16 member states of the EU. And on the right side you see this map which represents our coverage in dark blue. And membership is based on organizational commitment to the mission and the goals of Healthcare Without Harm, and also a desire to participate fully in helping to achieve them. And as mentioned, the members include hospitals, healthcare facilities, regional governments, and other professional associations, as well as other NGOs. Regarding our work on climate smart healthcare, we've been working on reducing the climate footprint of the healthcare sector since 2009 and engaging in the European debate on climate change and energy targets since 2010. And our work includes the publication of fact sheets, webinars like now, workshops, reports, which are all available on our website. And we are also we have this implementation arm of our work, which is the Global Green and Healthy Hospitals Network, which we're gonna refer to as GGHH. And here I'd also like to soon give over the floor to Nick, who is going to be our first presenter today. And Nick is the Network Director of Global Green and Healthy Hospitals, GGHH, and Nick works with GGHH staff around the globe, including us here in Brussels, to engage members, to build communities of support, and connect them to the tools and resources that can best assist them in achieving their sustainability goals. He has 10 years of experience in the NGO sector working on issues related to the environmental and public health and sustainability. So I'm going to give over the floor to Nick Thorpe and hear the first part of the presentation. Nick, the floor is yours.
Thanks, Victor, and thanks to Healthcare Without Harm for organizing this webinar. It's a pleasure to be with you all today and to share some information and really an invitation to join us in our work on climate change that Victor just talked about. I'll be talking about our Healthcare Climate Challenge program, which is really the main vehicle we've been using since 2015 to engage the health sector around the globe on climate. And really form a coalition of hospitals and healthcare facilities and health organizations making change within their own institutions to address their climate impacts, and also advocating for really all sectors to do the same. And so it's called the Healthcare Climate Challenge because we all know that the climate change is a big challenge facing the entire world. It's, as Victor said, one of the main priorities areas of Healthcare Without Harm. And I won't go into too many details about what we're seeing in terms of climate change impacts, but I think we're all seeing that happen more frequently everywhere around the world, and seeing that it is exacerbating a wide range of health problems in every corner of the globe. And so as we've seen climate change impacts increase every year, we see a real opportunity for the healthcare sector to mobilize and to advocate to protect public health from climate change. And so we formed the Healthcare Climate Challenge, again, as a vehicle for all of us to work together, for us to develop solutions to address climate change, and for us as the health sector to advocate for big change in all sectors to address this issue. And we know also that the healthcare sector is a contributor to climate change. Last year, we partnered with the World Bank to do a report called Climate Smart Healthcare, Low Carbon and Resilient Strategies for the Health Sector. And in that report, we estimated that 3 to 5% of the annual carbon emissions from developing countries comes from the healthcare sector. And in the developed countries, that percentage is even higher at 5 to 7%. So while healthcare is treating the sick, and while healthcare is treating illnesses perhaps related to climate change, healthcare is also a big contributor to carbon emissions and to climate change. So there's an opportunity for the healthcare sector to address these issues and reduce the footprint. We also see that as climate change is happening, that healthcare is not prepared. As we see bigger weather events and storms taking place around the world, as we see droughts happening in Australia this year, as we see extreme heat and wildfires happening in the United States and in Europe, we see that when these incidences happen, healthcare is not prepared to serve the communities. And at the same time, this is one of the most important times for healthcare to be available is during these events. These two pictures are from hurricanes that happened in the United States over the past several years. And when these events happened, hospitals were shut down, they were evacuated, they weren't prepared to deal with these changes in weather and being able to serve their communities at their time of need. So there's a big opportunity for healthcare to become more resilient and to adapt to these changing climates. And so the Healthcare Climate Challenge outlines an opportunity for us all in the healthcare sector to work on climate change. One, as I mentioned, is to address the carbon footprint and the emissions coming from our operations. And so that is to reduce the carbon footprint of the healthcare sector. And it's also to, in instances where hospitals and clinics don't have access to good power or reliable power, it's making those available on a wider range and using solutions like renewable energy to create stable power while not having a large impact on the environment. The second is that healthcare is on the front line of climate change. Again, we need to be prepared to serve our communities during extreme weather events. We need to be prepared for shifting burdens of disease and really to stand resilient during this important time. And finally, I think the last piece is one of the most important, is that healthcare is a trusted voice around the world, and that when doctors in the healthcare sector speak, people listen to us. And so we have a big opportunity to be leaders in this work, and in that the way that we're reducing our carbon footprint, the way that we're wanting to become more climate smart in our operations, we can influence other sectors to do the same, and we can use our voice to advocate for policies at national levels or regional levels or international levels to address climate change, and we can use our investments to advocate for these as well. And so that really serves as kind of the backbone of the healthcare climate challenge. And so it's framed around 3 pillars related to those opportunity areas: mitigation, resilience, and leadership. And so our objectives with the climate challenge are several. One is that we want to engage and invite all of you who are working at hospitals or healthcare facilities, health systems, regional health authorities, or health care organizations to join the challenge, to demonstrate that you can make the changes at your own facility and also be a part of a collective movement around the world of your colleagues and all of us doing this together. Secondly, we want to measure the impact that we're making. I'll share some data at the end of the presentation about what the climate challenge participants have achieved so far and what they're targeting. But the more that we work together and the more that we aggregate our impacts, the more impact that we can have on advocating for other sectors to do the same. We want to encourage the development of climate smart health systems around the world. Again, these are health systems that can have low carbon emissions while still delivering quality care in their operations. These can be health systems that are employing renewable energy to be able to provide stable and accessible care to their communities in more rural areas. And we also have opportunities, again, for healthcare to play a leadership role, to advocate for healthy climate via economic strategies, policies, and communications. So these can happen, again, at the local level, at the regional level, and at the international level. So who can participate in the climate challenge? We have a wide range of participants so far, and really this is open to all members of the healthcare sector, whether it's a hospital, again, a small rural clinic, a regional health authority or a health system, or another health organization working on these issues. We really welcome everyone to join this challenge and to all work together and sharing our experiences of how we can be successful in addressing climate change and how we can form a powerful voice to advocate for this work around the world. I think it's really important to note that we have a wide range of participants. Some are very advanced in their climate programs. Some are just getting started and interested in this work. Some hospitals have very large footprints that they're coming in and looking to address. Some have very small footprints and are looking to, again, use the climate challenge and use their climate program as a way to provide stable care in rural parts of the world where electricity is not readily available. And so it's really a wide range, and I think it's really for everybody, and we really welcome everybody. And the more people participating, the more powerful our voice can be. So to participate in the challenge, again, it's open to all different types of healthcare facilities and healthcare organizations. We have a pledge that we've created that frames what I've just spoken about, these 3 pillars of the climate challenge, that we ask interested participants to sign as you come into the challenge as a healthcare facility, we ask you to kind of look inside your organization and see what you might be able to target as a carbon reduction goal, and share that with us. And then share data about your progress and projects over time towards achieving that target. We really want to use the climate challenge as a way to create a network of exchange on this topic. We see so many incredible approaches to addressing climate change from the health sector all around the world, and I think it's really powerful for us to be able to share those experiences so that people across Europe can learn from one another, so that people in Europe and healthcare facilities in Europe can learn from other organizations in Australia or in Asia or in South Africa about the approaches that they're taking, and really be able to create this learning community and community of exchange. As we see this progress happening, we've created an award program to recognize the leaders who are achieving success and really serving as models for others to learn from. And so we have a Healthcare Climate Awards program that we've been running since we launched the program in 2015, and we'll be continuing that this year, and really look forward to recognizing really the climate champions that are out there, that are all of you doing this work and achieving success. And again, as Victor mentioned, this is in collaboration with Global Green and Healthy Hospitals, and for those organizations or healthcare facilities and hospitals that aren't already a member of GGHH, signing up for the Healthcare Climate Challenge provides membership in that program, as well as access to a variety of resources and tools. So to date, since 2015, when we launched the Healthcare Climate Challenge, we have over 180 participants who represent the interest of more than 17,500 hospitals in 26 countries. The uptake of this program has really been incredible to see. Again, the participants are so diverse, coming from, as you see here, a number of countries. Again, they are large health systems, they are individual hospitals, they are small healthcare facilities. It's a really diverse group, and I think that diversity is really the strength of this participant group and of the Global Green and Healthy Hospitals network. So many different approaches and strategies that are being shared, and that we can all learn from. With participation in the Healthcare Climate Challenge, we've developed a variety of tools and resources to assist members and educate members in different strategies and approaches they may be able to take at their own organization. A variety of those are guidance documents and case studies and member resources that we've compiled into a really elaborate packet for members to learn from. We've also been building tools, some of which have been built in collaboration with Healthcare Without Harm Europe, for participants to be able to understand their impact and understand their impact from different areas. And so we've built some calculation tools for healthcare facilities to be able to look at the carbon footprint of their energy use. And so we have a calculation tool that, based on your location, based on the type and amount of energy that you're using at your facility, you can get a carbon footprint calculation, which then can serve as your baseline and something you're working against to address. We've also built an anesthetic gas impact calculator as well. And so this is a tool that allows you to put in the type and amount of anesthetic gases that you're using at your facility, and again, in real time, see what that translates to in carbon emissions. So we think these tools are really helpful, and we hear from members that they're using them and helpful in understanding, again, where they're starting from, understanding what their impact is, and then with that knowledge, being able to set out programs and strategies to reduce them. And we'll be looking to build more of these in the years to come and continue adding in resources that serves the community in working on climate. As part of the climate challenge, as I mentioned before, we ask that participants share their progress with us over time in how they're doing on their climate programs to reduce their carbon footprint, as well as reporting the different approaches and strategies that they're taking to adapt to climate change, to become more resilient, and to exert their leadership in this area. And so we've developed a variety of forms and data tools in a data center we call Hippocrates that is available for all participants to use. It's also where participants will find the calculation tools that I just mentioned. And this is where you'll enter data each year, and where that data will be used to evaluate for awards that we hand out annually. Built into the Hippocrates data tool is also a variety of graphs and charts that, as you submit data over time, will demonstrate your progress. So you can see how you're progressing on reducing your greenhouse gas emissions from your baseline, how your work is progressing on deploying more on-site renewable energy, and a variety of other areas that allow you to visualize it and then communicate that out to your own communities. And finally, again, as I mentioned, we've been doing Climate Champion Awards related to the Healthcare Climate Challenge since we started first in 2015. We've done them every year, and we'll actually be launching the new call for submissions of data for awards for 2019 just next week. And that'll be open for a few months, and we'll be looking forward to announcing our next round of winners and climate champions in June of this year. And I think this is a really great opportunity, again, to recognize those participants who are achieving progress, who are having successful strategies, and really wanting to recognize them internationally and showcase their work. And there's a lot of opportunities that come with the award winners related to presenting in webinars, to showcasing their case studies in a variety of areas, and presenting at conferences and other events that we'll be running throughout the next year. So finally, I wanted to end on this. As I mentioned before, we've seen some really great impact of the Healthcare Climate Challenge participants so far. By the year 2020, participants have committed to reducing their carbon footprint by 16 million metric tons of CO2. They're already saving over $381 million US from energy efficiency projects and renewable energy programs. And this is having really great impacts, we know, on the community. And this type of data is really powerful for us to be able to communicate out and say the health sector recognizes that climate change is a major issue for the world, and the health sector is stepping up to address it. I think this is, really part of the powerful communications that we can do together to advocate for other hospitals and healthcare facilities to join us in this work, and again, to advocate for larger policy change to address climate change. And so it's a pleasure to have shared the information with you today and to present on this webinar. For more information, you can find a section on the Healthcare Climate Challenge on our website, greenhospitals.net. And of course, we welcome you to reach out to myself and Victor and other members of the Healthcare Without Harm Europe staff if you are interested in joining, and we'd be happy to talk you through that process and welcome you. So thank you very much.
Thanks, Nick, for guiding us into the Healthcare Climate Challenge and providing us the food for thought to start a discussion with two of our European Challenge participants and all of you, the audience, by typing your questions into the question box. So our next speaker is going to be Claire Topping, who is the Energy and Sustainability Manager of Northampton General Hospital NHS Trust. And Claire is responsible for creating and implementing the Trust's sustainability strategy, meeting targets for carbon reduction and waste minimization. And among others, she also ensures sustainability considerations are included in quality improvement project monitoring and maintains investors in the environment accreditation for the Trust. And she has an in-depth understanding of specialist outsourced services to the healthcare and related markets around the world, including sterilization services for medical devices and other manufacturers. Coming to the institution that she represents, the Northampton General Trust, a trust of the National Health Service of England. It's a medium-sized acute district general hospital based on the edge of Northampton, the Midlands, UK, serving a population of 380,000 people. And it has been originally on site since 1793 and extended over the site, currently operating on an area of 9,600 square meters. And with a total number of 700 beds, they issue 42,000 day cases and over 46,000 emergency admissions. The Northampton Trust carries out over 5,000 operations annually in 16 operating theaters and had in excess 650,000 patient contacts in the last year, working with over 2,000 full-time employees. So just to getting a first feeling of the size of this institution. And coming to their climate action efforts and their entry into the challenge, they set a target of 28% overall greenhouse gas emissions reduction by the year of 2020 from their baseline year, which is 2011. So diving into how the challenge has been supporting your area of work, I'd like to start with the first question to you, Claire, and ask you, what steps have you taken to mitigate and adapt to climate change in your institution? Claire, the floor is yours.
We have taken a number of steps. As you mentioned, we've got quite an old site. It's also quite a sprawling site. But we've been looking at our energy use and our carbon emissions for quite some time now. So we've done the usual things. We have put in our LED lights, put them on sensors in multiple occupancy areas. We've reviewed our settings on the BMS, so at one point everything was on 24/7, even things that were only outpatient clinics that nobody went anywhere near at the weekend. We've installed variable speed drives. We also have done quite a lot of work with Salix, so we've managed to get interest-free loans for a lot of these things that we've done. So we've spent about £2 million through Salix. But our big reduction came from changing our energy centre a few years ago. And we've got boilers, gas boilers that go back over 40 years, so 1973, so they're nearly as old as me. And so we replaced, well, we took out one of those. We've replaced the CHP units that we had on site. So they generate, the new CHP unit now generates about 80% of our electricity that we require, so we've reduced our imports from the grid. And we also put in a biomass boiler at the same time, which can be quite controversial, but the biomass that we've sourced comes from a local tree clearance company. So they clear trees from our site by the Highways Agency. They do the Althorpe Estate where Lady Diana grew up, so they're very local and they're based only 6 miles away. So that also reduced our carbon emissions by about another 600 tonnes. So since about 2012, we've managed to reduce our carbon emissions from our building, from our heating and lighting, by about 34%. So we're not so great on the adaptation. So we have a legacy of quite old buildings, so cooling is going to be a big priority for us. We are looking at a site-wide cooling strategy. But in common with a lot of trusts in the UK, we do have business continuity plans and adverse weather plans and heat wave plans. And I guess our biggest issue when it comes to adaptation and climate change along with cooling is going to be all those flat roofs that we have. So flooding in the local area is going to be our biggest risk that we now have to mitigate against, along with supply chain risks.
Thank you for answering the first question, Claire. So We've heard about improving energy efficiency. We've heard about the diversity of electricity generation, some of it coming from biofuel boilers, and only the rest is coming from the grid, if I understood it right. So moving on to the next question relating to these, what you have just told us. What are the challenges and the key success factors for bringing this institutional change along?
I guess the biggest challenges for us relates to the age of the estate. So whilst it's been here since 1793, we do have wards that we still use that were built in 1903. And so we have quite a mix of buildings, and we have mixed occupancy, and it's very difficult sometimes to make changes to these. So you can't turn the heating off in some areas without starving the rest of that building. So we've got very old distribution boards and infrastructure. We have asbestos in some places, which makes it very difficult. The introduction of Wi-Fi is going to be a big help, I hope, to that. It's quite difficult to get access into the wards to do anything because we're always busy. We're always at full capacity. I can't remember a time I've been here 7 years, and I think for 6.5 of them we've been using escalation areas some of the year. And we also have a lot of south-facing buildings that were built in the days when keeping everybody warm was more of a concern than keeping people cool. And of course, access and capital costs is quite a big issue for us, and having the resources to put in any new schemes that we might have. There's always competing requirements for that. Fortunately, we have an estates team that's very keen and eager to try new things out. Our director of facilities that we had for several years was very keen to, and he was a sustainability lead for the board, so he was a big advocate of energy saving. And our new director of facilities is a previous head of estates, so he understands the issues that come from trying to reduce energy, and also the advantages, not just from a financial point of view, but also getting other people on board as well across the trust. They like to hear about that they're making a difference, and that the trust is trying to reduce its environmental impact.
All right, so if I get it right, you really have a mix of infrastructure of old and new buildings, old and new wards, and that comes with the challenges to making changes, especially when the wards are under high capacity. And there is several examples when it comes to, for example, the recent summer of 2018 in Europe, and we heard that the NHS, the National Health Service of England, was dealing with hospital wards being very, very warm and hot, and patients had to be cooled. So I'm getting a fair picture of what challenges you're dealing with there. And then moving on. While the EU is just about to adopt a long-term climate target for 2050, the UK Climate Change Act of 2008 obligates the health system as the largest public sector emitter of carbon emissions to respond to meet these targets, which are entrenched in law. So already having this started within the NHS, how has GGHA and the climate challenge helped you set and achieve your sustainability goals?
As rightly said, we do have the Climate Change Act, so all trusts within the NHS have to report annually on their carbon reduction, and it's part of a standard contract that we have a carbon reduction plan in place. And we are asked about that every year from our commissioners. And we do report to our board, and we put in our annual report for all of our stakeholders and anybody that's interested to see how well we are doing when it comes to climate change. And the government has just revised the targets as well. So we are on track to meet our targets for 2020. How easily we'll manage the 2050 targets is open to debate, without a major decarbonisation of the grid and to move away from fossil fuels. I think when it comes to Hippocrates, we're already measuring our carbon reduction. But the fact that to sign up to the challenge, we had to get our chief executive to sign the pledge, gave an opportunity to raise that at a high level. And we also raised it through our Sustainable Development Committee first, which has a doctor on there, a nurse on there, people from IT and finance. So it allowed us to raise the profile a little bit there and start that conversation and remind them about what we are doing. But also when we got the Silver Award, it was something that we could then shout about across the hospital, use on social media, and it raised the profile once again. So I am the person that does sustainability in the hospital. I'm the sustainability team, I'm the energy team. So one person in 5,000 has to use everything they can to raise the profile and get people talking about climate change, sustainability, energy use, carbon reduction. And Hippocrates is a great way to show that, not only from the climate change but also the waste perspective as well.
All right, thank you. So in the case of an NHS trust, Hippocrates and the data platform might be a replication of work, and you already have to report and publish carbon reduction and the plans around it. But what I'd like to highlight from what you said is that first of all the challenge has to be signed. The pledge has to be signed by hospital management. So it really involves and engages the hospital management, as well as through what you've just said, through receiving an award and receiving visibility in engaging in climate action, also engages everyone else, the whole hospital, the whole community, as well as the health workforce. So thanks so much, Claire, for sharing these insights with us. And I'd like to move on to our next speaker, Carlotta Brask, who is the Director of Sustainability of the region of Stockholm. And Carlotta has worked on sustainability within the health and public transport sector for nearly 15 years. And she holds a master's degree in analytical chemistry from Lund University. And in this role, she is responsible for overall and strategic environmental and social sustainability issues, as well as for the process of monitoring economic sustainability in the Stockholm region, which has reduced its climate footprint by 70% compared to 1990 levels. So, in regard of the region of Stockholm, they're dealing with a population of 2.3 million inhabitants, and the region of Stockholm is responsible for all publicly financed healthcare, being one of Europe's largest healthcare providers, with a growing population and also increasing healthcare demand. And most of the care is provided under the region's own management, and around a third is dealt with by private care providers. And as part of an ambitious environmental program, the region committed to a reduction of at least 50% of greenhouse gas emissions by the year 2021, compared with 2011 levels. And here we talk about scope 1, 2, and 3 emissions. And when it comes to the long-term target, by 2050, region of Stockholm shall reach climate neutrality. As further details, the county operates 6 emergency hospitals with 2,800 beds, issuing 40,000 healthcare visits every day. And just within healthcare, the region is employing 38,000 people. So moving on, and I'd like to ask now the same first question from Carlotta. What steps have you taken to mitigate and adapt to climate change in the region of Stockholm? The floor is yours.
Okay, thank you, Victor, for the introduction. Yes, the region of Stockholm, we started our environmental work in the beginning of the 1990s, and at that early stage we didn't really talk about climate. It was more about exchange our energy to buildings and vehicles, talking about more like volumes and percentage of renewable energy. So we started to exchange the energy from our public transportation and other transportations, ambulances, for example, and also the heating, cooling, and the electricity. So now we have about 96% renewables for the heating, the cooling, and 100% for the electricity. And the transportation is like 100% for the buses and something like 70–80% if we include all the transportation. But later on, we translated this into carbon dioxide equivalents and calculated and set goals more in a climate way than just volumes. So we have reduced the climate impact with 70% since 1990, but that's due to the buildings and the transportation and a little bit the laughing gas, and 45% since 2011. So we moved from energy, and then we have added on laughing gas to reduce the impact, and also now we are working with anesthetic gases to find different ways to reduce the impact. But now we are also moving in a direction to work with the indirect. This is more like you're talking about the scopes, but it's getting more and more complicated. But we have also to reduce the climate impact from our consumption, consumables, textiles, medical devices, and also the indirect climate impact from the construction and the building materials. So that's, I mean, our long-time goal now, reaching, as you said, the climate neutrality. We have to work with the consumption and the construction as well. And regarding the adaptation work, we have done a little bit regarding to the public transportation and the tubing. We have both trains and buses, and we also have a tube system. But we have been quite spared here up in the north regarding the healthcare and the buildings. So it was actually first time this summer when it was really hot that we had this drought and fires and different difficulties in Sweden. So this was the really first summer, and then we experienced consequences like condensation affecting our storage of medicine and also disposables. We had the operation theaters that we had to close down, and we also had really difficult problems with keeping the facilities at a comfortable temperature. For example, having to do really direct, we had to ask our ice cream company for extra, so they had to drive with 950 kilo of ice, one of the ice cream companies, to help on one of our hospitals. That was a very acute situation. So I think we have to work more about having plans for the adaptation. That's the learning from this summer, I would say. Thank you.
Thank you, Carlotta. Okay, so you really mentioned or touched upon a little bit on all scopes of emissions, and the third one, emissions from the supply chain, is definitely a more complex one. But I think in case of an advanced Nordic region like the region of Stockholm, this really can be a piloting or a trend-setting first move when it comes to climate action of healthcare. And also regarding adaptation, I mean, ice cream for the adaptation strategy is a very interesting one. but I believe there is several more. And also like to ask you, so for this work, what challenges and key success factors did you come across?
Yes, I would say one major challenge is, of course, to make time and resources to put the climate or environmental issues on an already strained agenda, of course, because the people working in the healthcare sector, they are saving lives. And that's very direct and acute, and we have to address something that is a little bit more slow, like the climate change, but I would say after this summer, it's not really slow and it's very acute. So, to have some key success factors is awareness, of course, and knowledge to train the personnel in environmental issues, and then also support some, like me, the experts, we have to support data and facts to serve the leaders, like with incentives, why to work with the environmental issues. So that's like the base, but also environmental management systems like ISO 14001 has helped us to have routines and agendas, and also, I mean, if you have the management system, you need to train the people in order to get your certification, for example. You need to have goals. That has also helped to create structure regarding climate and environmental issues. So, and sometimes also you could work a little bit broader, not only with climate, you work with hazardous chemicals, for example, and other things that can also drag the climate question a little bit further. So sometimes you use the climate to drag the other questions and the other way around. So try to work with the whole palette sometimes is also helpful. Yes.
You mentioned awareness among leaders and policymakers. So what is the driving force in your organizations for this action? Does it come from the national level, or is it the subnational level pushing this?
Yeah, I would say in Sweden, as we have the healthcare system, it is on a regional level. It's really been driven from a regional level. And we do not have a climate act with goals and a need of reporting on a national level. So this is very much driven from the regional. And I would say that the driving force has mainly been from the politicians on the regional level. They have decided upon really tough goals regarding environment. So that's like the top bottom. And then I would say we have a lot of engagement and driving force from the personnel working in the healthcare sector. I can see that especially the nurses, the personnel working, they have a very easy way of take in the environmental issues, or take in the climate change, maybe because they're working very close to the patients, and they have a kind of feeling for that this is important. I would say that the top management, not the politicians, but the next level, the top management, is not always that perceptive because they have other issues to deal with. So I would say top political level and the people actually working with the patients on the floor, they are the hardcore, driving force in our organization.
Thanks so much, Carla, for sharing these insights. And we actually have a few questions also coming in from the audience. And we have a question here from Susie Berman. And this is directed towards the Northampton General Hospital. And the question is, what date Northampton General Hospital will be using to report against their 2020 target? Will they be following the NHS financial year, in which case it will be 2019 or 2020? Is it alternatively the calendar year with the end date of December 2020? This question is coming from within the NHS system.
So for the reporting that we do, obviously, normally we would report on the financial year, so anything that goes to the board is done on that. For Hippocrates, because I collect my data monthly, I report on a calendar year basis. So for the 2020 target, I will report on the 2020 calendar year, January 2020 to December 2020, and from an NHS perspective, it would be April 2020 to March 2021.
Thank you, Claire, for answering Susie's question, and I believe it can be for fostering this participation within the NHS. There is actually a government agency, the SDU, which you work closely with, the Sustainable Development Unit of the NHS, and I'm sure you or the SDU is sharing these things between the trust. And all right, we have also another question here from Anon, and the question is, what are the profiles of people who submit data to the challenge? Is there a recommended department or position that should participate? I guess this question is addressed to both of you, Carlotta and Claire. Who would like to go first? Or no, sorry, actually this question was assigned to Nick, but anyone feel free to jump in and answer.
Sure, I'm happy to jump in. I guess it really varies, from organization to organization. Oftentimes it is the sustainability department at the hospital that's doing this work and reporting the data. And as I think Claire or Charlotta would say, that takes retrieving data from a variety of departments within their organization or within a hospital. So that's often seen as one approach. We have energy managers in some instances. We have people from the engineering departments who have this data and are submitting it. So I would say it varies across organization, and we're happy to be flexible and then provide access for submittal of data as it fits and is appropriate for each organization, and that we work, a lot with the contacts that we have in the challenge to support them in doing that and support them in working with their own teams to compile the data.
Thanks, Nick. And really, just when it comes to our work at Healthcare Without Harm and GGHH, it's mostly these departments, sustainability department and sustainability and energy managers of a variety of healthcare institutions. So I think we're slowly reaching time. However, as a closing remark, I'd like to ask all of you, what would you recommend to us who like the Healthcare Climate Challenge? Let me know who wants to go first.
Yeah, I can go first. So thank you. Or is Claire talking now? No. I would say to start to find the aspects, like know your data, make climate pies, find the elephant to like a kind of sort what's the large climate impact, what's the small one, so you actually know that you're working with the ones, like I said, the elephants, and also do some benchmark. So you can, when you talk to your top management, for example, you can say the examples of other good projects, but also to set it in a perspective. This is the climate impact from our organization, this is the national ones, and these are blah, blah. So you have kind of, you can make different climate pies and actually really know that you're working with the largest data, the most important areas, and also find medical doctors fronting this question in your organization, and then just sign up and start to benchmark with other organizations and measure and just, happily improve your climate or reduce your climate impact, I would say.
Yeah, it can be started with a first analysis and smaller steps. Claire, perhaps would you like to also recommend something for newcomers?
I think I would just echo what Carlotta said. First of all, get your data. It gives you something to show how well you're doing as well. Not only find the biggest users of energy, find the easiest ones that you can change. So for some people, it will be easier to get people to turn lights off. For others, it'll be easier to put sensors in, for example. So find those easy wins, and then you can start shouting about how well you're doing, and find what makes the impact for different people. So don't make assumptions. Just because they're in finance doesn't mean finance is the thing that is most important to them. And you'd be surprised how much people want to save the planet.
All right. Thank you so much for all of you to engaging with us in this webinar and diving into these insights. And here I think we're concluding our webinar. And thank you for all the participants who have joined in and also posted your questions. This webinar will be available online on our website, recording of this webinar, and stay tuned because Healthcare Without Harm Europe, we also do webinars and we have actually in other areas as mentioned in the beginning. So there is upcoming webinars in our other topics. So stay tuned and thank you so much. Enjoy the rest of your day. Bye-bye.